All right. Good afternoon, Natioshia. How are you today?
I'm doing well, thank you.
Good, good. Well, thank you so much for taking the time to meet with me today. I was excited when I saw your resume, and I want to get right to it. So, why don't you tell me a little bit about the type of work that you do?
Well, I started in the medical billing and coding. I'm familiar with both, including insurance, but insurance is not included on the accreditation. But I have been responsible in my various roles over the past about 5, 6 years. I've been responsible everywhere from the front of the house, dealing with patients and insurance and their billing and their concerns and their questions, and the back of the house as far as coding and billing when it comes to payment on the payer side as well, posting payments as far as um, correspondence, reconciliations. I'm very well versed in just insurance altogether, private payers and commercial and government payers, including the VA, because I know that's its own thing by itself. I have also worked with patients face to face sometimes, and most of the time over the phone, having to deal with either scheduling or their questions with their concern with their bills or insurance questions or just navigating their health concerns altogether, just depending on the various roles that I've been in. I've worked with different specialties, the ER, pathology. I've done some private primary care work as well. I've done some durable medical equipment work as well, which all of them always included multitasking and doing a various amount of things, not just one job title, which is one thing that I like about this part of the healthcare industry and this part of the business is you're able to do multiple things as doing one repetitive thing over and over.
Absolutely. All right. So you were at a quick assignment at the Excellence Health, and then before that, XFIN. What type of business is that?
Zyphon is a
Xyphen.
third party billing company out of California. I work remotely.
Oh,
And it was a third party billing company that a creator there in Simi Valley, California. We
mhm,
billed for clinics that were underfunded. So we would bill the government insurances, or if they did not have, sliding scales. So
mhm.
it was work remote. So I worked their AR and their front of the house as far as insurance goes as well.
Okay. And then Duvaswaco, you were there. And I want to say 2022. Was that when they did the layoffs or started to?
Yeah, they changed over. I started with Duvasako. I wasn't even there 3 months before they got bought, and they were bought out by Venture Health. And
Mhm.
with them coming, a lot of people, I didn't get laid off. I actually left on my own because they changed the job descriptions, and they wanted each department to be compartmentalized,
Mhm.
and where they wanted to place me was kind of like in a call center type of role, and that was not something that I was interested in.
Okay, and because you were doing medical billing for them,
Yeah,
like you had specific clients, okay. And
yeah,
then you did patient account coordination for Lincare.
yep,
Oh, and then also I see that you have your certification for certified insurance and coding, and then your diploma in medical billing and coding.
yes.
Perfect. Um, Wonderful. So let's talk a little bit about customer service. So out of these positions, in person. Which did you do any of them in person? Was the patient account coordinator in person?
No, that was well, Dulasako was hybrid. So
Yeah.
I was in office and remote. Depend was in office most of the time, but when somebody would get sick, then they would send everybody home. So we
Mhm.
just kind of was able to flip flop between the two. The other positions, Lincare was in office as well. That was pre-COVID, and then when COVID happened, they sent us home, which the office ended up closing because they just weren't ready for at-home work. It didn't work. It didn't work
Yeah.
at all. So they actually just closed the office, and the role at Excellence Health was in person. Actually, I had my own office locally in Daytona.
Okay. Now the position that I was telling you about, of course, is an in-office position here in Daytona Beach, where you are going to be, working with different clients, visitors as they come to the facility. Can you think back of a time that maybe you had to assist someone who had a challenge? So, and what that challenge was and how you resolved it?
I would say the most recent would be at Excellence Health, my personal office, because those providers provide care to patients in the community, so at their homes or at facilities. But my office was attached to one of the 4 clinics that they had. So when a patient would have any questions or anything, I could just pop over to the clinic and help when the front office staff could not. And this particular patient, she had a speech impairment, and I'm not sure, it was not like from birth. It was something that came on like a medical reason.
Mhm.
So it was very hard for people to understand her. So I brought her in my office and I just gave her a pen and a piece of paper, and we communicated that way, and highlighters. And this is, she had concerns about her bill and what. So we got through it. It took us an hour, but
Okay.
I was able to explain to her, and she was satisfied with the answer, and she was very, very, very happy at the end that, I took the time out, which I wouldn't mind, because I always think if it's my family member and I can't assist them, I would want somebody to be kind enough to just, treat them like a human and meet
Sure.
them where they're at. It doesn't matter what position you hold, or if you can meet them where they're at and explain and help them, why not?
Sure. That's great answer. Great answer. Can you tell me a little bit about like how you prioritize? Like, I'm just thinking of a busy front desk, from times in my career or places when I've gone to a business, like the phone is ringing, you're trying to schedule an appointment, you've got somebody you need to verify insurance details, maybe your boss asked you to do a project. How do you prioritize all your tasks when you have lots of them?
Well, when it comes to multitasking for me, I am a really good multitasker. I guess by default, even though I only have one child and he's 18, he's 17, gonna be 18. It has just always been in my nature. So my thing is, I write myself lists, I keep calendars. I'm very good at, on a daily, giving myself 5 or 10 minutes when I come in to realize what needs to be done and checklist off and just prioritize as far as what I can do right now and get off of my list. And when it comes to, maybe it seems like the role would be dealing with face to face and some back office things. For me, somebody in my face would be priority right then,
Mhm.
because their question or concern would be more than likely something I can take care of in a quicker manner.
Sure.
And then I would just prioritize everything that way. And I make tangible, deadlines for myself. And
Mhm.
if I need more time where I'm not able to, achieve something in that deadline, I'm very vocal about it. I'm not ashamed to say, I might not get this project done by this Friday, but if you give me till Wednesday, or if I can get some help, enlist people for help that way, or just be vocal about the transparency of what I can and cannot do, or what would make it go faster. That's how I
Mm.
organize.
Absolutely. Great, great, great answer. Regarding it's always multitasking organization. People say it all the time, but it's important to be able to explain it.
Yeah.
So now, did you work primarily with a team or were you working independent or did you have the opportunity to do a little bit of both?
I did both. I would say it would be a 50-50 split. When I
Mhm.
was in a lead or a management role, it was more independent. It was more independent on myself, especially the role with Excellence Health.
Mhm.
It was, they did not have a billing department. A clinician was just doing the billing on the side. So it was more independent of, I had to create and come up with process and procedures on my own. So that was more independent. But at times you do have to work with a team to cross over with departments and all the other roles. Anything back office when it comes to healthcare, it takes a team. So I would say it's about a 50-50 split depending on the task.
Okay. And then how do you learn best, like when you're being trained?
I'm a hands-on learner and I'm a note taker. I have I would say I would say on technology, I'm a fast learner, but because I take notes and I like to make sure I notate things to refer back to, because I love to work independently and not have to ask the same question twice, that causes maybe my learning to be a little bit more elongated, just because I have to take the time to write it how I understand. But I
Sure.
do learn better, hands-on, with somebody showing me and telling me, and I can write it down.
Okay. And then my last question for this part of the interview, why don't you tell me a little bit about your computer skills and the softwares that you've used?
With When it comes to the medical side, I've used Epic, I've used NextGen, any type of Microsoft or any type of those things. I'm very versed in insurance portals. I'm an expert in whether it's government insurance or commercial paper payers. I'm very, very good at obtaining the information that we need and getting access to any of those portals, and learning them without any instruction or demo.
Okay, terrific. All right, well, I'm going to go ahead and stop this part of the interview, but don't go anywhere. We got a few more things to chat about.
Okay.